Hi all, today in this video we are going to study about the pyramidal tract, which is also known as corticospinal tract, along with the corticobulbar system, as it is better to study both the pyramidal tract or corticospinal tract along with the corticobulbar system. Before going to study about the corticospinal tract or pyramidal tract, we can see two scenarios. First one is, if you get a case like this, that is 60-year-old hypertensive male, means he is an old hypertensive, means increased blood pressure. He is having increased blood pressure and he is admitted with the complaints of sudden inability to use his right upper limb as well as the right lower limb. That is, same side of the body he is unable to use, that is the right side. Along with that, he has an inability to speak. And on examination, there it is found that there is an increased tone in his right side. In the right side, he got an increase in the tone, as well as on that side there is a loss of superficial reflexes, whereas the deep tendon reflexes are exaggerated. This is one case scenario. And the second one is again a 70-year-old hypertensive male has come to the hospital with complaints of inability to use right upper limb as well as lower limb. And the physical examination here revealed hypertonia, that is increased tone on the right side along with exaggerated deep tendon reflexes on the right side. Here there is one more additional sign, that is Babinski sign is positive on the right side. So if this type case scenarios came, most probably the lesion will be in the pyramidal tract or in the corticospinal tract. So today we will see in detail about the corticospinal tract or the pyramidal tract. Before going to study about the pyramidal tract, we should have a small idea of about what are the cortical motor areas in the brain. These motor areas, they are mainly located in anterior to the central sulcus, that is in the posterior 1/3 of the frontal lobe. And in human brain, there are three areas which is connected with the motor activity. The first one is the primary motor cortex, second one is the premotor cortex, and the third one is the supplementary motor cortex. So now we are going to start about the corticospinal tract or the pyramidal tract. And this is the first tract which is discovered in the man, and it is one of the longest tract. And one of the peculiarity of the corticospinal tract or the pyramidal tract is that it takes 2 years after birth to become mature functionally. That is, only by the age of 2 this tract become functionally. And this is the whole diagram which you are supposed to draw when the pyramidal tract is asked to draw and label, and this is the complete diagram. So if you are drawing this diagram, then it will be better to score more marks. So we will explain each part of this pyramidal tract. Origin of the pyramidal tract. The fibers of the pyramidal tract originate from three areas, that is 30% of the fibers originate from the primary motor cortex, whereas the another 30% originates from the premotor cortex as well as the supplementary motor area, and the remaining 40% it arises from the somatosensory area posterior to the central sulcus. So you can see here that not only from the motor cortex, from the sensory cortex also the some of the fibers of the pyramidal or corticospinal tract arises. And there is a scientist named as Betts in 1874 described the giant pyramidal cells which is located in the fifth layer of the motor cortex, and 3% of the fibers of the pyramidal tract arises from this Betts cells, whereas 97% arises from the other smaller cells located nearby. Now we are going to study about the course of the pyramidal tract. So I have already told it arises from the three areas, that is 30%, 30% and 40% from the various cerebral cortex areas. And fibers from here, they join together to form the fan-like structure here, that is the corona radiata. Okay, so this is the cerebral cortex, motor areas as well as the somatosensory area from where the pyramidal tract fibers arises, and the fibers join to form the corona radiata, which will reach the internal capsule, and these fibers will pass mainly through the genu as well as the anterior 2/3 of the posterior limb of the internal capsule. And from there the fibers reaches the midbrain, and through the midbrain it passes through the middle 3/5 of the crus cerebri. So this is the cerebral cortex, and this is the corona radiata, and this is the internal capsule, and from there the fibers reaches the midbrain. And from the midbrain the fibers goes into the pons and reaches the medulla. When it reaches the medulla, that is when it reaches the lower part of the medulla, there is a structure which is known as the pyramid, and it is formed by the crossing of the pyramidal tract fibers into the opposite side. So this area, it is known as the pyramidal decussation. So what happens in the lower part of the medulla is that 80% of the fibers will cross to the opposite side, and they forms the lateral corticospinal tract, whereas the 20% remains uncrossed, and they forms the anterior or the ventral corticospinal tract. So please remember to draw these crossed fibers in a thick form, because 80% is crossing, and whereas the 20% you have to draw in a thin pattern, because only 20% remain uncrossed. And you can see here that this lateral corticospinal tract ends in the lateral funiculus of the spinal cord. That is why it is known as the lateral corticospinal tract, whereas the anterior or ventral corticospinal tract, it is actually ending in the anterior funiculus. That is why it is known as the anterior or ventral corticospinal tract. And this ventral or anterior corticospinal tract, which ends in the anterior funiculus, they does not cross midline until it reaches the level of the muscle, and they remain uncrossed and they descend into the anterior funiculus. Whereas the lateral corticospinal tract, they descend into the lateral funiculus. And next is about the most important portion in the pyramidal tract, that is the termination. So you can see here that this pyramidal tract mainly synapses with the alpha motor neuron in the anterior horn. So this is the anterior horns, and in the anterior horns there is alpha motor neuron. So this corticospinal tract, whether it is anterior or it is lateral corticospinal tract, it will actually synapse in the alpha motor neuron, which is located in the anterior horn of the spinal cord. And this is the anterior corticospinal tract. They usually connect with the help of an interneuron to the alpha motor neuron on both sides. That is lateral corticospinal tract, it is connecting only with the alpha motor neuron on that side. But you can see here that the anterior corticospinal tract, it connects with the interneuron, and by means of interneuron into the alpha motor neuron on both sides, that is here in the here side, in the left side, as well as on the right side of the body. And that is about the corticospinal or the pyramidal tract. Next is about the corticobulbar or the corticonuclear tract. This corticobulbar or corticonuclear tract is just some fibers arising from the pyramidal tract and supplying to the cranial nerve nuclei. So this corticobulbar or corticonuclear tract, other name for corticobulbar tract is the corticonuclear tract. They runs throughout the brainstem, and the fibers are given off from the pyramidal tract to the motor cranial nerve nuclei on the opposite side. And you know that in the midbrain, the third and fourth cranial nerve nuclei is located. So fibers from the pyramidal tract in the midbrain, it is actually giving the fibers to the motor cranial nuclei, that is 3 and 4. But what happens in the pons? Here the cranial nerve nuclei 5, 6, 7 is located. So from the pyramidal tract, fibers are going into the 5, 6 and 7 cranial nerve nuclei in the pons, and in the medulla the fibers are given off to the 9th, 10th, 11th as well as the 12th cranial nerve nuclei. So this is in short about the corticopyramidal tract. Everything have been given in this picture. So if you are going to draw this picture, you will score 100% marks. Next is about the functions of this corticospinal tract or the pyramidal tract. You know that it is mainly concerned with the voluntary muscular movements, that is the initiation of voluntary skilled movements, and the functions of the lateral as well as the anterior or the ventral corticospinal tract differs. Lateral corticospinal tract mainly control the muscles in the distal portion of the limbs, that is hand as well as feet. So this mainly mediate fine skilled movements, whereas the ventral or the anterior corticospinal tract control mainly the muscles of the trunk as well as the proximal portions of the limb, that is axial muscles is getting controlled by the ventral corticospinal tract. So it mainly helps in the postural adjustment as well as the gross movements. Whereas the corticobulbar or corticonuclear tract, the fibers are given off to the cranial nerve nuclei. So it mainly controls the muscles of the pharynx, larynx, palate as well as the facial muscles, jaw as well as the eye. Next is about the lesions of the pyramidal tract. In case of lesions, if the pyramidal tract or corticospinal tract is affected, there will be loss of ability to initiate the voluntary movements. So, you know that the lateral corticospinal tract mainly controls the distal limb muscles. So, fine movements will be affected if lateral corticospinal tract is affected. And when the ventral or anterior corticospinal tract is damaged, the gross movements, that is the axial muscles are affected. So our walking, climbing, that mechanisms will be lost. And whenever the lesion occurs above the pyramidal decussation, there will be loss of voluntary movement on the opposite side. That is, whenever the left pyramidal tract is affected, right-sided weakness, that is right lower limb as well as upper limb, we can't move. And you should also know these three terms, that is monoplegia means just only one limb get paralyzed, that is localized paralysis of only one limb, and this is usually seen in lesions of the cerebral cortex. Whereas hemiplegia, which you mostly get in case of internal capsule lesions, here the paralysis occurs in one half of the body. If the lesion occurs in the brain stem, that is midbrain pons as well as medulla, here along with the pyramidal tract, one or more cranial nerve nuclei can also be affected. That is cranial nerve nuclei producing same side of lesion, whereas you can also get the signs of upper motor neuron lesion on the opposite side. And if the lesion occurs in the spinal cord, both the corticospinal tracts may be affected. That is bilateral affection of the corticospinal tract resulting in LMN type of lesions. So depending upon the level of lesion, you can either get paraplegia, which means both your lower limbs will be paralyzed, or it may be quadriplegia if it occurs in the cervical level of the spinal cord. That is all four limbs will get paralyzed. So in this video, we have seen about the most important topic in the medical physiology, that is the pyramidal tract or the corticospinal tract. Together with it, we have already seen the corticonuclear or the corticobulbar tract, and about the lesions of the pyramidal tract or the corticospinal tract. So I will also upload a detailed video regarding the UMN and LMN type of lesions as well as the hemiplegia, which is one of the most commonly asked essay question. Thank you.